Maybe I'm just going to, we probably have 5 more minutes. So just treatment-wise, we talked about the tablets. So we said there's tablets, there's little sachets now that you can take. There's intravenous. So how should people think about, or maybe colleagues and our listeners, how they should think about supplementing their iron?
Okay. The most important thing to remember is there is a way to get your iron right. And do not give up if the first treatment you get gives you too much side effects or is not working. There are so many different types of things that can work. And if you've got constipation or diarrhea or something from the old cheap iron tablets, there are many new ones that one can try. Don't give up and don't blame your doctor. It's the name of the game. You don't know which one is going to work for who. Just ask your doctor for something different. If the oral iron tablets don't work, you need an iron drip. And these drips are very safe these days if given by people who know how to give them in the right place with the correctly trained people. And generally speaking, you can actually sort out a person's iron with a drip in one sitting, maybe 2 sittings for some who's really very anemic or so. But for most, you're going to be sorted out with 1 sitting instead of maybe 3 or 6 or 12 months of tablets. And if you add all those costs together, maybe the sums may make sense to go for the drip if you're struggling in the beginning. So speak to your doctor, tell them whether you are tolerating the iron or not, and nobody gets sorted out in 1 month. That's very unusual. You're going to need iron tablets for probably 3 months, and you need to check at the end of those 3 months whether you've sorted it out. And when you go for the test, don't take your iron tablets that morning of the test. First go for the test and then you take your tablets. Otherwise, you mess up the test. If you've been for an infusion, don't test for 6 weeks, because the infusion is going to affect those tests for 6 weeks.